Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Syahrul Michael bin Abdul Hamid. Together with my teammate Adam Danish bin Ahmadunija and Muhammad Faiz bin Cik Razi. Today we are gonna present about relationship between number of cases appear and number of death of COVID-19 patient. This is cover under topic 2, correlation and regression. For introduction, the COVID-19 has given significant impact on Malaysia since the first case was reported in March 2020. Monitoring of number of confirmed COVID-19 cases alongside the number of deaths is crucial to understanding the severing outbreak and assessing the effectiveness of public health interventions in Malaysia. For motivation, first one is inform the public. This is to help citizens to keep update about the seriousness of rising case numbers and why preventive measures are important to protect lives. Second one is support public health planning. Provide information that help Ministry of Health Malaysia and related organisations or agencies to properly plan resources such as hospital beds, ventilators and medical staff during surge. The third one is highlight the importance of timely interventions. Show how early detection, effective containment measure and vaccination campaign can reduce mortality even when number of cases arise. Our objective is to examine the relationship between number of COVID-19 cases and number of deaths in Malaysia. After that, our objective is to identify pattern or trends over different waves of the pandemic in Malaysia. Lastly, our objective is to highlight factors that may influence the relationship such as healthcare capacity, vaccination and new variants.
So hello, my name is Adam Danish and I'm going to explain about data collection. So our team use Kaggle website to search and find the information. As you can see in the table, there is mine total case for X and total death for Y. There are also a calculation for XY, X square and Y square. So our team also use Excel to rearrange the data into its proper place. And as you can see, there is summation table where it includes summation of x, summation of y, summation of x square, summation of y square and summation of x and y, and the value of r.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Faiz bin Razi. I will continue with data analysis based on data we have collected. So we can make a scatter plot for total case versus total death. And then we continue with the Pearson coefficient correlation to find R. So based on the formula given, we can calculate based on data we have collected. So we have got R is equal to 0.8710. Hence, there is a strong positive relationship, linear correlation between total case and total death. So from the data we have collected before, and then we can continue with the C. There is equation of regression line to calculate B and A. So the formula have been given to find B and A. We calculate it and we can put it into formula Y equal to BX plus A. And then we can go to the example of a prediction using regression line. We put the total case, for example, 13,000, put it in from formula Y, and then it got the value of Y is equal to 93.529617. From this example of prediction, the expected total death is 93.529617 if the total case is 30,000. We continue with the discussion of the slope of the regression line and its mean. The slope, we put it b equal to 0.02483, indicate that for each additional COVID-19 case, the model predict an increase of approximately 0.0025 death, reflecting a slight but positive relationship between case and fatalities. And for the last one is value of R2 for the regression model and interpretation of its mean. From the calculation, we got the R is equal to 0.87110, and for the R square, we got the value is 0.758941. So this implies that 75.8941% of the total deaths is due to COVID-19 case. So that's all from me. Thank you. Now I will continue with interesting finding. For the first one is relation between total case of COVID-19 and total death. We notice that total death will increase every time the total case is increased. For the second one is impact of the total death when total case is increased. Based on the slope B of the regression line, for each additional increase of COVID-19 case, the model predict an increase of approximately 0.0025 death. And for the last one is news report every day to notify the people. Back in 2020, news report always showing the data about total death of people because of the case COVID-19 to notify the people to stay at home for not spreading the virus. That's all from me. Thank you.
So for the conclusion, there is a clear relationship where in Malaysia between the number of COVID-19 cases and the number of death, where as you can see, if the cases of COVID-19 increase, the number of death also increase. However, this relationship has been modified by factors such as healthcare preparedness, the emergence of new variant, and the widespread vaccination, which reduce the case fatality rate over time. And for the future work, including total of people recovered and vaccinated, by expanding our analysis, by adding people survive when they got infection of COVID-19 and how much can vaccinated patient help to recover from COVID-19, and they expand scope area. By expanding our scope of data analysis, more country can differentiate and find ways to counter COVID-19 more efficiently. So that's all.